I just wanted to say sorry it took me so long to get these videos up, but it is quite difficult when you're not technologically inclined. So I want to start off by saying that there are a lot of chapters in this textbook. We may not be able to get to them all. However, I've had to pick and choose out of the 16 chapters which would be the best ones to cover. And I have found that picking usually the first 8 or 9 chapters is always the best way to go. Only because you will see these theories and approaches again. You'll see them in your NCE exam the day you decide to sit for your license. So I want to make sure that you understand those therapies, that you understand some of the basic concepts, and that you know how to utilize them. The book is a great read, and I really do hope that you all are using it, you're reading your book, and that you hold on to it. The case studies in the back are excellent. I keep thinking we're going to have time to go through one, but as you can see, the time in class goes by relatively fast. We never really quite make it all the way through. And if you can look at the slides as we go through this lecture, you're going to see there's a lot of slides, and I sometimes have to skip through some of them. There's just no way to be able to cover all of them. So I hope that some of you are doing your reading on your own, and that also helps us to spark some kind of conversation or discussion in class. Please don't just solely rely on me and my lectures to give you that information. Read the textbook. What I give you too is just an outlook, a view, and how to apply that to some kind of practical setting. But if we don't role play in class, because I know a lot of you are hesitant about that, but if we don't do any of those things, you're never really going to get to see how it works. I can give you case studies, I can give you hypothetical situations. However, it's a little easier when you can get down, sit down, know how to question, know how to go along the lines of communication, the therapeutic responding. That's really important, is learning how to do that. These are just techniques that don't come naturally. You've got to learn them. So if you want to follow along with me on the slides, we're going to cover Chapter 9 on Existential Psychotherapy. This is probably by far one of the most valuable ones that I find. Anyway, that's just my opinion, but I really like it and I use it a lot. There's a lot of existentialism in the work that I do, and I think that once we get through this, you're going to see what I mean. But it's probably one of the only approaches that you can use that you can integrate and collaborate with other methodologies and approaches, because it focuses on the here and now, and it really gets the patient or your client to start recognizing that they are the master of their own ship, or basically the master of their own universe, is that they can change at any given moment, but that it puts the responsibility back on them. It gives them accountability for their outlook and for their path. Rather than offering a new set of rules for psychotherapy, it represents a way of thinking about human experience that can constitute a part of all therapies. And it asks the deep questions about the nature of anxiety, despair, grief, loneliness, isolation, anime, meaning, creativity, and love. It really does make them stop and take a good look at their lives. You know, it was Erickson who said it best, who said that once we reach that age of 65, that eventually we will sit back and we will look at our lives with ego, integrity, or disparity. And we want people to start recognizing now in their life and knowing that they can pave their own path, that they can make those changes, that they can go in the direction that they want to go in. And rather than wait and look back and have regret, start acting now. This approach also suggests that there's a lot of little throw-ins. Okay, it kind of leaves you open. Think of this approach as a more liberal approach. It allows you to do a lot of different things. It allows you to incorporate other approaches, other ideas and concepts, because it gets the person, like I said, just thinking in the here and now and acting for today and for tomorrow. It's a real goal-oriented type of approach. It regards people as meaning-making beings who are both subjects of experience and objects of self-reflection. So what that means is it's not solely just subjective. It forces people to have to sit back and take a look at their lives and be accountable and look at what they've done and say, okay, I put that out there. It's all about accountability. You know, whether you put something positive or negative into the world, you have to own it. And it makes them ask those questions like, what's the meaning of life? What's the purpose? Why am I here? What am I supposed to be doing? And how can I become this epitome of self? It's a real type of approach where you get that epiphany at some point in time in your life. And we will all reach that, where it just dawns on us that, wow, I really do have so much control in my life. and I could do so many things. It's like the question I posed in class when I had asked you all about whether or not you thought we were a product of our past. And a lot of you said that yes. But to say that would suggest that if you were victimized as a child, you must still be a victim now as an adult. Or that because of the victimization that you have grown up to be stronger, or that you've grown up to be weaker. Experiences are just that. They're meant to be things that have already happened to you. They will influence you. They will persuade your outlook. It helps you learn a lot about yourself. But that's not concrete. That's not something that cannot change with time. Also, when I postulated the other question about what do adults wait for? It's like we have this inner child that's constantly awaiting some kind of validation or some kind of permission or pardon to do those things that we want to do. This approach allows people to recognize, I don't need to wait for that. I can do this. I can achieve all those things. I don't need anybody's permission but my own. And it's a real eye-opener. It's a real awakening for some people. It asserts that only in reflecting on our mortality can we learn how to live. That doesn't necessarily mean we have to get to a near-life death experience, although that could definitely help some people, but it's not suggesting that. What it's saying is that as we sit back and we look and realize that life does come to an end, and that things will come to an end, and that we may not be able to achieve all the things that we want, it stops and really makes people think, oh, okay, well, I need to take action now. I need to step up. I need to take care of things. It really forces people, like I said, with that accountability and responsibility for their lives. It says each of us is responsible for who we are and what we become. And it takes the blame, not like psychodynamic does, where it's always trying to find somebody to blame for why the person became the way they did, or the behavioral or cognitive perspectives that say, oh, it's your maladaptive schemas, it's the past history, it's the things that you've learned. And behaviorism says, well, it's the environment that shapes people to become this way. This one just says, you know what, be responsible. And this is all you. This is that theory where I told you it comes down to the common denominator, and that common denominator is you. Authenticity and subjectivity, because there's a huge difference, right? Because theories may dehumanize and objectify people, authentic experience takes precedence over artificial explanations. Meaning, like other theories, like cognitive theory and psychodynamic, suggesting, well, remember in psychodynamic it was that whole what if, or if then causation kind of thing. If this happens to somebody, then this is bound to happen. Or cognitive theory that suggests that watching you on the outside and seeing what you're doing and seeing how you behave and how you're interacting suggests this. This takes away from that, and it takes away from totally being objective and telling people what they're experiencing is allowing them to have an authentic experience. It subjects them to live in that moment and to explain what it is that they were going through. Your textbook has a really great case study in there about a young man who's talking about, I think it was a pretty funny example, but it's kind of true, but it's talking about a moment when he's in an intimate moment with his girlfriend. And he becomes very concerned because he's young and he has no medical problems or issues that he knows of. And he becomes impotent at the moment of intimacy. And the therapist starts talking to him, and all he can concentrate on is the fact that that happened. But he's not looking at what led up to that moment. So as they start looking at it and peeling away and being subjective and in the moment, and he's thinking about it, and he starts to get aroused again while he's in the doctor's office, then suddenly the thought pops in and he realizes what it was that he was thinking. And what had popped in is he said, I was in the moment, I was getting excited, she touched me, I got an erection, but then I started thinking to myself, what if I can't get it up? And then the erection went away. So it's kind of a funny example, but a lot of people are not aware of the things that they start to think or that pop into their head right at a moment that actually forces them or causes them to do something. Like to step away, or like an immediate, like say for example somebody who's afraid of rejection. You know how psychodynamic would suggest that if a person is afraid of rejection, it's because growing up their caregivers rejected them a lot or kept them, separate or at bay, and so consequently they didn't learn a lot of those attachment skills. Cognitive therapy would suggest that that was a maladaptive schema for rejection, or for failure or abandonment, like what we looked at with schema theory. So for humanistic existential, or existential psychotherapy rather, it suggests that it isn't that, it's the very thing that led up to that moment that popped into your head. So say, for example, you're at a party and you like somebody and you want to go and approach them. A psychodynamic would say you probably won't approach them based on your experience of relationships with other people. Sorry, my nose itches. And you won't approach that person, but cognitive therapy would say, well, you didn't approach because based on past experiences, schemata, and the outcome, you have reinforced this self-defeating thought that you have that you're worthless or that nobody would want you, so they're going to reject you. But existential therapy would say, okay, go through the motions, lead up to it, experience it. You want to go to that person, you're getting built up. Right before you approach them, something pops into your head and you veer off to the other end. Why did you do that? And a lot of people say, well, I don't know why I did that. It's just, they want to go back and blame, well, it's because in the past I got rejected. And existential therapy says, no, you will not go back and blame. You will not go back and rationalize, justify, nothing. Look and see what popped into your head right then and there and get going. It's a real motivational kind of thing. I think existential psychotherapy just takes us to a different level. It's like with motivational speakers. And remember how I told you I do a lot of motivation speaking. This is precisely why I love this approach, because it works every time. It's like you can really reach into people. And I get a lot of people that I work with that would often tell me, Mary, you're like the psychology doctor, you know, you're like a surgeon. You get in there and you pick out what it is that's going on and you pull it out and put it in front of people and they become, oh wow, it's like a real aha moment. And I told them it's not that. I just focus on the here and now. I really want people to pay attention to what it is that they're thinking right at that moment and stop that negative thinking before it proceeds. A lot of telemarketing companies, marketing companies use this strategy when they train their people. So if you've ever worked in sales, you know exactly what I'm talking about. When experiences are molded into some pre-existing theoretical model, they lose their authenticity and become disconnected from the individuals who experience them. Once again, that's going back to utilizing past experiences and incorporating them into now and justifying them or rationalizing them. And we don't want to do that in this approach. Existential psychotherapists focus on the subjectivity of experience rather than objective diagnostic categories. Love that. It focuses on existential crises, and what those are is just like every theory that we've looked at before. You know, when psychodynamic looked at the ego crises, okay, we're looking at existential and existential therapy. And remember the premise behind existential therapy that talks about the meaning of life, the purpose. So consequently, if a person is having a difficulty foreseeing their future in the here and now, there's got to be some kind of existential crisis they must be encountering now. And it's a diagnosable presenting symptom that may mask an existential crisis. Existential dilemma ensues from the existential reality that although we crave to persist in our being, we are finite creatures. We are thrown alone into existence without a predestined life structure and destiny, and each of us must decide how to live as fully, happily, ethically, and meaningfully as possible. That's a huge responsibility when you stop and think about that. Is that if you had to sit back and really think about what is my purpose in life, what is the meaning, I always tell people I have the meaning of life. And everyone's like, well, tell me. So it's whatever you make of it. It really is. Because if you set yourself some goals and you say my purpose in life is to do something, or I want this to mean something to me, only you are the creator of that. Only you can cultivate that. Only you can bring that purpose and meaning into your life. Only you know how to be authentically happy. There's no one in the world that could fulfill that for you, that could make you happy. This is solely your responsibility. People can come and go. People will enhance your life or take away from your life, but ultimately you are the only person that you're going to be stuck with and that you have to love and cherish and take care of and nurture. So this approach really does throw a lot of responsibility onto a person. Now, could it work for everybody? Probably not. I mean, you wouldn't want to use this type of therapy on working with somebody with a severe mental disorder like schizophrenia or something, or personality disorders, because you're going to make them suicidal, honestly. I mean, not that that's funny, but when you stop and think about it, when you lay that much responsibility on somebody, they're looking for answers for resolution, and you use this approach with them, and they may not be able to find that within themselves because they've been lost for so long. So you have to be really careful about whose approach you could use. But you see, you can still use some of these techniques in other therapies. So I mean, it's not to say that you can't use this, but you got to just be careful about what you use. So let's look at the 4 categories of ultimate concerns. You're looking at freedom, isolation, meaning, and death. What do we mean by ultimate concerns? Well, these are the things that we want to focus on, just like other theories have talked about their basic concepts. We're looking at these as the ultimate concerns of trying to achieve, like the goal, where we want to get the client. Freedom, we are the authors of our own lives, a terrifying responsibility that we dread and attempt to escape. How true is that? Is that we all sit there and talk about how important it is to be free and to have this freedom, but with that comes a great deal of fear, because when you know that you have all that freedom, what's to stop you? Who's to set those boundaries or those limitations if not you? Isolation, interpersonal, intrapersonal, or existential isolation. And interpersonal meaning between me and you, intrapersonal within self, and existential isolation is, do I not go out into the world and live and have a meaningful life, or do I just stay back and do what I'm expected to do? Meaning, search for substantial purpose providing life structures often throws us into a crisis, because it's an ongoing search that we go through, that we're constantly trying to find. It's like that book, if you ever get a chance, read A Purpose-Driven Life. Even though it's based on a Christianity and Christian aspects, it really does talk about that, about people finding meaning and gratitude in everyday living. And death, awareness of death is painful, but it enriches lives. And it really does. I can't tell you how often in working with people, especially working with seniors or people who are terminally ill, just how much of a realization they make as they approach that time, especially the elderly, when they're not sick, but they just know that death is imminent, it's going to happen. There's something quite rewarding and enriching in how they choose to interact with others and how they choose to take themselves seriously. The therapeutic stance for existential therapy is the fellow traveler. What does that mean? Remember how in psychodynamics we were talking about the therapeutic alliance? Are you with them, or are you the healer? Are you the person on the journey with them? Between the therapist and the client and existential is you are like a fellow traveler. You are along with them with this journey, but what you do is, like what the slide is saying awareness of ultimate concerns as givens of existence produces a relationship between therapist and patient or fellow travelers. We're traveling through this life together. And it labels a patient therapist, client counselor, suggests distinctions between them, the afflicted, and us, the healers. We really do take on a really healing approach, because it's not unlike other ones where we're working solely with the mind, I guess, or the behavior. But here we're working kind of like, it's going to sound kind of dorky, but with the soul is what we're doing. We are all in this together. No person is immune to the inherent tragedies of existence. I usually like to use this little saying, is that we're all in the same boat, but we're not in the same boat together. So ultimately we are able to help one another. And sharing the essence of the human condition becomes a bedrock of therapeutic work, which means me understanding what it's like to be human, and that there's human error and there's suffering, and that there's fear and anxiety and depression included in that because of the ups and downs that we experience in life, is allowing that person to know, hey, I got what you're saying because I too am human. I don't have all the answers, but as long as I'm traveling right here with you, we're going to find those answers that best suit you. And I think it really brings them a lot of peace of mind. Existential psychotherapy has never formed specific institutes because it deals with issues underlying therapy of any kind. It's since what I said is it reaches a real the existential. Remember at the top of the apex of Maslow's theory. Once you reach self-actualization, it was Viktor Frankl who came and knocked that apex off and said, no, we continue to grow, we continue to evolve. Self-actualization isn't the end of it. Okay? Existentially oriented psychotherapists tend to further their knowledge through personal therapy, supervision, and reading. The therapist never stops evolving. Okay, concerned with rediscovering the living person and dehumanizing modern culture, its human-focused approaches to psychotherapy suffer in a climate of market forces, which, what I think that that's talking about is because we focus on the humanistic element or side of what it means to be human, and we're constantly growing and we're teaching people how to become better people and how to grow from there. The market right now, with those real alternative therapies and all these soul searching, like, I don't know if you've seen it lately, but there's actually training that you can go out there where you can teach people how to find a guardian angel, things of that nature, because it's so revolutionary out there, and it's so, I don't know, a new age, I guess. A lot of people frown upon this therapy. They don't realize the therapeutic value in it because it's just been marketed beyond belief in other varying ways, like self-help books and so forth. If we look at the existential theory or approach through the theory of personality, it focuses on whether or not people are living as authentically and meaningfully as possible. Are they fully using all their assets and positive attributes? Because really, it is perfectly normal and human-like for us to always focus on our negative qualities rather than our strengths. And it utilizes a dynamic model of personality as a system of forces in conflict with one another. Emotions and behavior may exist at different levels of consciousness. Once again, it goes to that whole thing again that sounds real new age, but remember how I told you that there's all this belief out there that we only use 10% of our brain, but that's not true. We use all of it because it all does something different, but are we really using it to full capacity? And existentialism suggests that we are not, that we could be so far more capable than what we have shown, and that we can be far more advanced than we allow ourselves to be, but there's always those constraints, those restraints that we put on ourselves, that we don't allow ourselves to live more authentically or to full capacity. If you look at the existential psychodynamics, the existential model postulates that basic conflict is between the individual and the givens, the ultimate concerns of existence. So it's not between the id, the ego, and the superego. You're not having a psychodynamic conflict within yourself. You're looking at being aware and the anxiety and the defense of ultimate, your defense mechanisms outside of you. Is like, okay, you have this drive, you have this motivation, but you're always meeting resistance or something on the outside. So does that make you put up a defense and not want to move forward or not grow? And therefore you allow it to push you back, or are you constantly trying to break through those barriers? So it's a whole different type of conflict. It's not within you. It's between you, the outside world, and how you see yourself and how you perceive yourself in that outside world. Sources of anxiety and conflict. A certain amount of anxiety is normal, inevitable, and an aspect of every personality. If you remember abnormal psychology, remember that stress and anxiety are important. We would never want to be without them because it's what helps us to respond. So it's not like we're trying to alleviate that or completely do away with it. It's normal and everyone should have it. Aspects of freedom include responsibility, willing, impulsivity, and compulsivity. So aspects of freedom is not so much doing something just because you know you can, but also having the ability to self-control and to regulate, not be impulsive, not be compulsive, but do things in moderation and also take full responsibility for anything that you put out there. So if you choose to be impulsive, know that whatever consequences come your way are solely your fault or your responsibility. Relationships showcase perils of merger and isolation. Using it in relating, people may react with fusion or compulsive sexuality. Do we believe that we complete other people, or do we believe that we enhance other people's lives? Do we believe that we are good alone, or that we must have somebody else in our life? And in what capacity do we want them in our lives? Like Freud constantly suggested that we are sexually driven and motivated. An existential doesn't believe that. However, what does it mean to you to become involved with another person, to interact with another person? Do you find that as a compliment? You're merging together to enhance one another? Do you take away from each other? Those are all the consequences that you would have to live with, is knowing how you impact other people's lives and how they impact yours. To cope with the terror of death, we erect defenses against death awareness. That's also would be a source of causing some anxiety. Remember, this is what it's talking about, is source of anxiety and conflict. What raises anxiety? Freud would have suggested that anxiety is due because of those three, remember? It's either moral anxiety, it's real anxiety. And an existential says, no, we cause ourselves anxiety because we allow it to, I guess, fester, to grow. But it could be caused because of our own doing, because of the things that we're doing out there in the world. It talks about denial systems and specialness. Individuals have deep, powerful beliefs in personal inviolability, invulnerability, and immortality. At a deeply unconscious level, we believe that the ordinary laws of biology do not apply to us. People can camouflage their fears of death behind a belief that one's specialness would somehow override it. And people may seek therapy when the defense of specialness fails to ward off anxiety. That is a defense mechanism. It's a denial system of specialness. It's thinking, oh, this can't be happening to me. This shouldn't be happening to me, or this will pass. This will go away because I have a greater meaning and a greater purpose. That's being in denial. Now, if you're waiting for a greater force, and this therapy does talk about that, is that you're waiting for a greater force. The ultimate rescuer is what it's talking about. Okay? And this is not defiling on anybody's religious beliefs, but it's just saying, you know how, let me give you an example. I got a client who sits there and talks about, she has all this anxiety. Right now she's on the verge of being kicked out of her home. She doesn't have anywhere to go. She has no money. She has no job. She's an elderly woman. She's trying to figure out where she's going to go from here. I'm always trying to get her to look into resources. I cannot fill applications out for her. I can't do any of that. But I know she qualifies for HUD. Medicare would cover a lot of things. We can actually get her into assisted living. But I'm constantly trying to give her those things and make her accountable, make her responsible for taking care of those things and getting involved in her own future. Because there's something very successful about that, is that once she does that, she's going to realize, I'm not a failure. I'm not weak. I took care of all these things, and look, I'm okay now. I'm in a home. I'm good. But every time I put something before her and say, okay, this is what you're going to have to do if you want to make this happen. And we're constantly reviewing goals and saying, this is where you want to be, this is what you want to do, but these are all the things you got to do to get there. And she'll sit back and go, I know. I don't want to do it anymore. This is just so stressful, it's so much anxiety, and I can't sleep at night, and I'm so depressed, and, I'm just going to leave it in God's hands. Whatever happens to me is going to happen to me. But I've been good. I've been a good person. I've done good things in my life. I don't deserve this, and I don't really think God is going to let this happen to me. That's fine. Have your religious beliefs. But in the end, if there is no ultimate rescuer, and you are it, can you really sit back and give yourself some forgiveness for having not stepped up to the plate and taken care of your business? So the belief in an ultimate rescuer is also one of the denial systems that existential therapy talks about. And that is the belief that someone is watching over one and in a different world. People may imagine the rescuer to be human or divine. They may result in a character structure displaying passivity, dependency, and obsequiousness. And individuals may dedicate their lives to locating and appeasing an ultimate rescuer. And that one talks about, I'm going to go out and do good deeds. I'm going to go out and do this. There's something different about being altruistic. Okay, and altruism comes from existentialism. Is truly being altruistic is doing for another person without expecting anything in return. But what of those people who go out and they do good deeds and do that because they ultimately believe that in the end it will get returned to them in favor, like karma, so to speak. So that's what that's talking about. Okay. The theory of psychotherapy behind existentialism is it provides a frame of reference rather than a comprehensive psychotherapeutic system. It views patients in human rather than behavioral or mechanistic terms. And it may employ a variety of techniques used in other approaches if consistent with basic existential presuppositions and a human, authentic therapist-patient encounter. Totally being authentic with your client is the biggest thing. It's not pretending to be something that you're not. Trying not to portray this ideal of perfectionism. Vast majority of experienced therapists across ideologies employ existential insights because it's fantastic for getting them to realize and become accountable. Because ideologically, systems influence therapists' perception for systems, existential therapists notice patients' concerns emanating from existential conflicts. These are the sensibilities. This is the part of the theory, I think, that a lot of people come across and they're like, oh, how did you know? Or you read my mind, or oh, you're so good. And it really isn't that. It's just recognizing what they're experiencing and what they're going through and where their conflict is coming from. You could just be a great source of objectivity when you're sitting on the outside. You can see it. And it's all about how you word it and how you get it back to them. Like in my case with this patient, was I told her, I said, and I'll give her a name. Let's call her Anna. I said, Anna, that I'm glad that you have a lot of faith in God, and I'm sure that you have been a very good person. Just from the time that I've had knowing you, you come across as being a very wonderful person. That you probably don't deserve this, but I do believe that if there is this divine source out there that you believe in, because I'm not saying that there isn't, and I'm not saying that there is. However, if this divine source out there recognizes all the good things that you are, I do believe that he wouldn't hand you all these difficulties without knowing or feeling comfortable that you had the ability to manage them. It's kind of putting it back in her arena, but without discrediting her religious beliefs. It's just pointing out to her that, hey, you have the ability to manage these things. You can do that. Look at everything that you've accomplished over the course of your life. You've been very successful. I really cannot believe that you wouldn't be able to handle this now. And I'd sure like to see what you're made of, and kind of really motivate them on, okay? No therapist focuses on existential issues all the time. We don't, because even then I can incorporate my CBT when I start talking to her about those maladaptive schemata that she's got going on. And therapist knows that defenses may produce secondary anxiety. I want to point out to you on the following slides, the biggest thing is that the perspective of dealing with the here and now, and not from the perspective of a historical longitude, okay, which is going backwards and looking to see where you are now. As we look at the here and now, where are you going from here and moving forward? We look at the current life situation, we look at all the things that they're experiencing, we try to identify those challenges and barriers, whether they lie within themselves, whether they're perceived on the outside is the important thing too, and why this person feels like they cannot overcome it. The therapeutic goals of existential therapy focuses on the self-experience of the patient and capacity for self-actualization and self-transcendence through engagement in life, is learning from mistakes, feeling ultimate success, and superseding the impossible. Aims to reduce anxiety to tolerable levels and then to use the anxiety constructively. We're not trying to alleviate it or eliminate it. Remember, I told you it's important. It keeps people on their toes when you have a certain level of anxiety. Therapists identify methods and instances of responsibility avoidance and how patients make decisions and tolerate uncertainty. It addresses existential isolation directly, addresses meaningless with engagement, and confront death and death anxiety. Here are the mechanisms of existentialism: empathy, dealing with the here and now; dreams, fellow travelers, being genuine; therapist personal therapy experiences; therapist transparency, and seeks unfolding, meeting, and presence. Wonderful approaches, wonderful mechanisms to be using. If you look at your textbook and you read, you'll see that there are just so many wonderful examples that they give in there about how people can, I don't know, like embrace, I guess would be a good word, even the most traumatic experiences of their lives and recognize the meaning or the purpose behind it. I often use this too in working with soldiers, especially the ones that come back with the "why me" belief, or "why did I make it and somebody else didn't?" Or, what happened to God? Where was God? Why would an almighty, all-divine being allow something like this to happen? And having this conversation several times with many soldiers before, the one thing that I often express to them, because I don't degrade beliefs, is if they believe in a God and they wonder where God was at that moment, I often tell them, when at any point in time in your life did you learn that God was like a genie and that he would just answer your prayer and stop that from happening? It doesn't work that way. And faith is just that. It's blind, right? You don't see it all the time, and you may question often why things happen. Just like they question, well, I saw a lot of people in pain, or I saw a lot of people dying, and why would a good Lord let something like that happen? And I have to tell them, but this is what you perceive, and perception is reality. You don't know if in fact that person was in pain or what they were experiencing. If there is a divine source who is compassionate and understanding, then maybe he alleviated all that pain. And what you saw was your own suffering, was your perception of a person suffering, but really, ultimately, it's you that's suffering. That person's pain is gone. It's alleviated. It's done. And sometimes things catastrophic and traumatic happen in the world because there's lessons to be learned by that, whether it's your lesson or the person experiencing it. And we shouldn't draw away from that, and we shouldn't hate for that, and we shouldn't be angry. However, we need to embrace and understand that things in this world happen. And I try to get them to that serene place of understanding the purpose or the meaning behind things. Because like if they say, well, why did I have to live? He had a family, or she had a family, and they had children, and, you know, why couldn't they come home to theirs? Especially when I'm doing with single soldiers, and they say, I don't have anybody. And I tell them, but that's just it. Yeah, maybe you are meant to have somebody in your life. Maybe there's a legacy to be had for you. They've left a legacy. They have their children. They have a spouse. We all wish that we could complete our lives together with our partners, but if it doesn't happen, that doesn't necessarily mean that they can't move on and they can't have a life too. So we try to get away from that imminent or that end-all kind of thinking, because existentialism really does away with the all or nothing and the end-all way of thinking. Who can benefit from this? Therapy can be adapted to different situations and conditions. A thorough existential approach which, with ambitious goals, is most appropriate in long-term therapy. We always want to do this with people who are very goal-oriented. It's far more effective. Shorter durations can be effective, short-term goals, because it can be very powerful when a person sees a level of success, and then they're more inclined to set more goals. It's appropriate with patients who confront boundary situations like confrontations with death, important decisions, sudden isolation, or milestones with marked passages. I see this a lot, and I use it a lot too in bereavement counseling. I use it with people who've lost a partner, or whether it be natural, terminal illness, something catastrophic or traumatic, people who've lost children. I do it a lot with humongous changes in life where people suddenly get very depressed. It's very effective in working with those types, and it's really good with individuals, groups, families, and couples, especially couples, I think. When we start looking at that, bringing people together and enhancing each other's lives rather than, it works great in couples therapy because it allows people to be themselves, and it allows them to recognize each other for who they are, accept each other, find their biases and the challenges, and really help them overcome, because a lot of times they look at each other and they're like, I didn't know that about you when we got married. So they really learn a lot about each other. Let's take a look. If we look at some cultural considerations, those are important too. Only because cultures are very different, right? A lot of difficulties arise when treating people who have adopted broad formulas for managing these concerns that were provided by their cultural and religious systems. This is a part where existential therapy becomes a little tricky, like I said, because if you're dealing with people who have real strong religious beliefs, they're going to look at you a little cross-eyed and they're going to say, oh no, don't even talk to me about things like that, because obviously you have no faith in anything. So you have to be real careful about going there with that. Cultures create belief systems that defend against the terrors of stark confrontation with existential concerns. So like the fear of death and things like that. Or one method I often use too with people is that when somebody dies is learning through the grief counseling is learning to celebrate their lives and how to process that out. And you'll get a lot of people who say, oh no, we don't talk about them anymore, or no, you're not supposed to celebrate their life. I have to grieve for so long because these are just cultural beliefs that they have. So that's also important to consider. That's really it in a nutshell. I'm going to try and provide you guys another video sometime later today that can also shed light on other aspects. I do want to touch into Gestalt therapy a little bit, get you guys kicked off on that. And then I'm going to go to the end of the chapter and start making some videos and some more information about those upcoming theories. And that way we can get caught up, but more than anything, you'll have them to take with you and know, and maybe I can get one of my kids to role play with me and show you how it's done. Talk to you later.